Good afternoon, ma'am. We are the Group 9 and today we are going to discuss about community engagement. But before we start, let us introduce ourselves. So I am Jiona Abocado.
And I am Ivy Carretero. And I'm Brigette Marbella.
At this topic, we will know and of course we will discuss what is community engagement and including their prospect along with what are the challenges and principle in community engagement, as well as we will know what are the method and together with what are the approaches in community engagement, and last, understanding what is community engagement. What is community engagement? Community engagement is the practice of actively involving individuals and groups in the decision making, planning, and implementation of project, programs, and initiatives what their affect their community. So for example, in majority, or I could say that we all agree that we choose the feeding program as we community engagement.
Called stem from past experience of broken promises, unequal treatment, or a lack of transparency. So the next is reaching diverse communities. Engaging individuals from different backgrounds, socioeconomic levels, and abilities can be challenging. Engaging individuals from different backgrounds, socioeconomic levels, and abilities requires understanding and adapting to various communication styles and access needs and cultural sensitivities. The example of this is a community center planning a health fair may face challenges reaching low-income families who may lack of access to transportation or have limited English proficiency. They need to consider offering transportation to serve this population. So next is time commitment. Meaningful engagement requires time and effort from both community members and organizations. Meaningful engagement requires time and effort from both community and members and organizations. People may be busy with work, family, or other commitments, making it difficult for them to dedicate time to participating in community projects. Example of this is a community group organizing a neighborhood cleanup may struggle to get residents involved because people are busy with their jobs, taking care of children, or attending other events offering flexible participation options such as weekend cleanups or shorter volunteership, could help overcome this challenge. So next is lack of resources. Effective engagement requires resources for planning, communication, and facilitating participation. Effective engagement needs funding for planning, communication, and facilitating participation without adequate resources. It's difficult to reach out effectively, plan meaningful activities, and support participants. Example of this is a community garden project may lack the resources to purchase seeds, tools, and water, making it difficult to get started and sustain the project. Seeking grants, partnering with other organizations, or utilizing volunteer support could help address this resource gap. So next is measuring success. Quantifying the impact of community engagement can be difficult, making it hard to demonstrate its value and secure ongoing support. It's not always easy to measure the intangible benefits such as increased community trust, improved communication, or stronger sense of ownership. This can make it hard to demonstrate the value of engagement and secure ongoing support. Example of this is a community group works to improve a local park. It's difficult to measure the impact of the park improvements on community well-being, social cohesion, or crime rate. While there may be anecdotal evidence of positive change, it's hard to quantify this impact. So next is communication fatigue. Continual community engagement can lead to fatigue among community members who may grow tired of being asked for their views. Continual community engagement can lead to fatigue among community members. They may become tired of being asked for their views, especially if they feel their input isn't always taken seriously or acted upon. Example of this, a local council holds numerous public consultations about different issues such as transportation, housing, or environmental concerns. Residents may feel overwhelmed by the frequency of consultations and become less motivated to participate. Next is disillusionment. Community members can become disillusioned if they feel their input isn't taken seriously or action. This can lead to decreased engagement and a loss or trust. Community members can become disillusioned if they feel their input isn't taken seriously or action. This can lead to decreased engagement and the loss of trust in the organizations involved. Example of this, a community group proposes a new community center but the council rejects their proposal without adequate explanation or consideration of their ideas. This can lead to frustration and a sense of powerlessness among community members. So lastly is the resistance to change. People can be resistant to change, especially if they haven't been involved in the decision-making process. People can be resistant to change, especially if they haven't been involved in the decision-making process. They may feel like their perspectives are being ignored or that the change doesn't benefit them. Example of this is a local government plans to implement a new recycling program without consulting residents. This can lead to resistance from those who are accustomed to their old recycling habits and may not see the benefits of the new program. So the next is Jiona Abocado.
Good afternoon, ma'am. Today I will discuss about the prospect. Number one is technology-driven engagement. Digital tools and platforms offer new ways to reach wider audience, facilitate communication, and collect feedback. Meaning, technology is transforming how communities are engaged. Digital looks like apps, online surveys, teleconferencing, and social media enable more accessible and convenient communication while collecting valuable feedback. For example, as a nursing team could use a telehealth platform to educate rural communities about preventive care and gather our health concern through online service. Social media campaign can also raise awareness about flu vaccination drives targeting a wider audience. The second one are the focus on equity and inclusion. There's a growing emphasis on ensuring that all community members have an equal voice and opportunity to participate. For example, nurses in a community health program may provide interpretation service or written materials in multiple languages to ensure immigrant population understand healthcare program. Mobile clinics can serve underserved areas to ensure access to healthcare. The third one is data-driven insight. Collecting and analyzing data from community engagement can provide valuable insight into community needs, prioritize and preference, leading to more effective and target intervention.
For example, by analyzing survey data, nurses may discover the diabetes rates are disproportionately high in a specific community. They can then design targeted workshop or nutritional counseling session to address this need. The fourth one is building capacity. Investing in training and development program can equip community members with the skill and knowledge to participate effectively in engagement process, which means empowering community members with the knowledge and skill to actively participate in decision-making and healthcare initiatives. For example, nurses might train community volunteers to serve as peer healthcare educator, teaching them how to spread awareness and about chronic disease management within their neighborhoods. And the last one is collaboration and partnership. Working together with other organizations and stakeholders can leverage resources, expertise, and reach, creating a stronger collective impact. For example, nurses partnering with local school, public health department, and nonprofit to run vaccination drives, ensuring a large outreach and smoother coordination. Next slide, please. So let's move on principle and community challenge. Number one, we have a principle in inclusion, meaning valuing the opinion, needs, and cultural backgrounds of all participants. For example, a nurse respectfully consider cultural practices when discussing family planning in diverse community. Second one, transparency and accountability, meaning ensuring honesty and openness in action and decision while taking responsibility for outcomes. Example, a nursing program regularly update the community on impact on their health initiatives and acknowledge areas for improvement. The third one is empowerment and ownership, which mean encouraging community members to take charge of their health and decision. For example, nurses involve patients in developing personal care plans, empowering to manage their condition. And the fourth one is collaboration and partnership, which mean building alliance with the stakeholder to address challenges collectively. For example, as a nursing, work with faith-based organization to promote health screening during community events. The fifth one is sustainability and long-term impact, which mean creating programs that are sustainable and provide lasting benefit. For example, establishing community health worker program to ensure ongoing health support even after a nursing project concludes. And the sixth one are active listening and feedback, which mean prioritizing listening to the community and responding to their concern. For example, as a nursing hold focus group to gather community opinion on a proposed health environment. And the seventh are the cultural sensitivity, which mean being aware of and respecting cultural differences when designing and implementing program. For example, offering dietary recommendation in diabetes management that align with cultural food preference. And the next one is flexibility and adaptability, which mean adjusting strategies based on changing needs or unexpected challenges. Example, nurses shift to virtual health education session during a pandemic to ensure continuous outreach. And the last one are evaluating and learning, which mean continuous assessing the effectiveness of initiatives and learning from outcomes. For example, as a nursing collect post-program feedback to refine future community and workshop. By applying this principle, nurses as a nursing ensure our engagement efforts are effective, culturally appropriate, and inclusive. Thank you, ma'am.
So good afternoon, guys. Today, the methods and approach and the last one, community for them last share and so for example, as participated personal and allow us patient allow us regarding regarding the making issue making skills was of number and initiative community support and development practices. For example, refers to the teamwork enjoyed upang particular ng bawat at sa number 3, communication community share information access and for example communication information vital for communication is the information or verbal and non-verbal it is delivering properly operating with the help building trust with people. Number 4 capacity building and training and workshop city members with the need to participate. So for example the equipment analysis the testing of the knowledge into training exercise so for our standard equipment such and technology how to study in use and effectively and next slide understand about more than just and potential being community and organization. So for that initiation building knowledge sa mga pasyente, kaya may
Open cam.
Thank you, ma'am. That's the end of our discussion.